Today we know that the synonym is the same for the disease, but the biology is very, very different between the different subgroups of acute leukemia. And this mainly relates to genetics, and we have understood nowadays that the genetic subtypes in pediatric ALL are completely different from adult acute leukemias. I think we are in a very interesting phase because at the moment we have more information than we can utilize clinically. We know much more about the classification of acute leukemias, about the genetic setup, about the dysregulation of certain critical genes in leukemia, but we don't know yet for sure how to translate this into better treatment. Because in the long run, at least as a pediatrician, I think this should be our aim. We need to come away from the toxic treatments and go towards more specific, less toxic treatments. Because we know there are very critical long-term effects, in particular in children, of course, because they're growing organisms. And this is different from a patient who is maybe 70 or 80 years old. Leukemia is a deadly disease, by definition. So any news is big news. Some of the latest news are big news, but they will only be for the benefit of a very small proportion of patients. We are not at this point at the situation that we can do T-cell therapy in every patient. Completely unrealistic, extremely expensive. We don't know anything about the reasons why it sometimes fails, why it has some side effects which are also not trivial, but I think it indicates that alternative approaches like immunotherapy can be very promising, also in acute leukemia.